Right. Okay. Good morning, good afternoon, good evening, everyone, wherever you are in the planet. I'm Ravi. I'm the founder of Dentilligence. Where in the part of the Smile and Health series, we invite leaders from public health, from technology, from youth empowerment, and anything in between. So I'm delighted to have Dr. Kedar Prasad, who's a legend in his field, particularly in the diabetic side and the nutritional side. Pleasure to have you, Dr. Prasad. And maybe you can talk about your own work briefly so that the users know what's your expertise.
Yes, no, I think I'm mostly involved in the, for example, currently the treatment of any cancer, diabetes, cancer, they treat the symptoms of the disease, not the causes of the disease. And causes of the disease are four: reduce oxidative stress, inflammation, no treatment; increase in the intestinal dysbiosis, where the number of harmful bacteria increases and number of beneficial bacteria decreases. And when it happens, harmful bacteria produces a lot of toxic chemicals, including pro-inflammatory cytokines. And third is loss of collagen. Collagen, 30% of your total body protein is collagen. And therefore, it is present in all your organs. And one of the major functions of collagen is to maintain a structural and functional integrity of all organs, including brain, liver, every organ.
Right.
And so when you lose collagen, then you see in the skin, but you don't see in the brain. And so there was a study showing that as you grow older, the structure of the brain deteriorates, cognitive function deteriorates, and when they supplement it with collagen peptides, they all get restored. So the third thing is very important, is loss of collagen, which contributes to your poor health and as well as the incidence of diseases, increased incidence of diseases. And fourth one is omega-3 fatty acid. It is an absolutely essential fatty acid for your health, but your body does not make it. You rely totally on diet. And diet, if you take vegetarian, they don't produce sufficient amount. They produce what is called ALA, and that is very slowly get converted to omega-3. So the best thing is to take omega-2 if you want to correct it. Another problem with omega-3 is what it contributes to disease. This fatty acid, omega-3, is easily oxidized by free radicals.
Right.
And if you are old, free radical is all around anyway. So if you don't take any reducing oxidative stress, then your omega-3 will be oxidized and become non-functional.
Right.
And so these are four targets that contributes to the disease. And if you correct them four, you will have a good quality of life as well as reduced risk of chronic diseases.
Great. So that's a very strong start to our discussion, interview, whatever you call it. Let us try to understand, the work you have done. What has been your inspiration in working in the area in the nutrition, health, and disease? A little bit of your story just to make it live for us.
Yeah. No, when I was working in assistant professor at the University of Colorado Medical School, actually my interest was totally different. I was working on neuroblastoma cells, which is highly malignant tumor cells. And I just discovered that if you elevate cyclic AMP, then it becomes like a mature neuron, non-malignant. So that was the first evidence that that the cancer cell can be converted to normal cells. So I got a lot of recognition and so on and forth. But the reason I become interested in nutrition is the Linus Pauling. I don't know if you know, only American who won the 2 Nobel Prize. And so I just saw his paper showing that high dose of vitamin C alone in a patient with some kind of cancer reduces it. So everybody say, oh, he's too old to vote and so on and so forth. Ignored his work. But I thought he's a 2 Nobel laureate, can't be that wrong. Let me test on my cell line. Cell is growing in a petri dishes. So I tested neuroblastoma cell. They kill cancer cell, but did not kill normal cell. I said, that's weird. Then combined with X-radiation, chemotherapy enhances the effect of radiation on cancer cell, but protect normal cell. So I said, that's weird. Then I said, what about vitamin E? So I ordered all different types of vitamin E. And vitamin E succinate form is found to be the most effective cancer agent. And so from then on, I became very interested. I started with a single antioxidant, and then we developed a multiple antioxidant because certain aspect single antioxidant is not enough. And so really, Linus Pauling paper was the driving force for me. And then he became my mentor, and we collaborated a lot of stuff. So
Great. That's really good to hear. So again, making it a bit more broader in terms of, see, the chronic diseases are on the rise,
right,
generally across the world, even in the developing world and developed world,
yeah,
despite medicine making lots of progress, medicine science improving all of it.
because
So
they do
why?
not address because it failed, because it is increasing. You are correct. All chronic diseases, from cancer to neuro Alzheimer, Parkinson disease, you name it, increasing. Why? Because we are not treating the causes of the disease. And causes of the disease increase oxidative stress, oxidative inflammation, and also the intestinal dysbiosis. Many doctors doesn't even know what intestinal dysbiosis is. Loss of collagen, and also dysfunctional omega-3. These are
Right.
the four causes of diseases and poor quality of life during aging. So until you control these four, you are not going to do any benefit.
I mean, you talked about aging, and one thing is that you're an inspiration for two reasons. One is purely medical reasons. Second is the healthy aging. So
Yeah, healthy
I
aging.
understand you're 90.
Again,
So yeah, tell
it's
me a
very
little bit.
interesting that these four phenomena, if you control it, that you also control the not rate of aging, but the quality of aging, while quality of life while you are aging, because eventually everybody has to leave this planet. And but while you are here, you maintain a good health and reduce risk of any kind of form of disease.
Right. So I have gone through some of your papers. I'm not a medical expert, far from it, but
That's
the
okay.
micronutrients keeps coming as word many times. So for
Yeah,
a people who are not clinically trained, like people like myself, what
yeah.
is a micronutrient and why should we care?
Micronutrient is simply the antioxidant, all different types of antioxidant. Some of them our body makes it, some of them we rely from the diet. So it is antioxidant, different types. And then B vitamins, some minerals. These three things combined is called micronutrient. And
Right.
micronutrient is absolutely essential for your health. And but one of the major function of micronutrient is reduce oxidative stress and inflammation at the same time. Then it is effective micronutrient. Many micronutrients which are sold in the marketplace, they are no good because they cannot reduce oxidative stress and inflammation at the same time, simultaneously.
Got it. Right. So getting back to sort of more focus area of our research, for example, diabetes.
Yes.
What's the connection between nutrition and diabetes? I mean, as a layman, we hear all of it, but
Yeah.
it'd be good to hear
The
some from you.
name that you are correct. For example, accumulation, if the glucose cannot be used, and the way glucose is used, whenever you eat, the stomach sends a signal to pancreas, send me some insulin. Insulin comes, insulin goes to cell membrane and binds with the receptor, insulin receptor. And then insulin receptor activate another messenger molecule called AKT or protein kinase B. When they get activated, they send another message to the glucose transporter, which is lying in the cytoplasm, migrate to cell surface membrane and let the glucose come in. then they get signal, they migrate to cell surface, glucose come in, utilized for energy.
Right.
So this is the normal mechanism. But what happened if you don't take care of yourself? Oxidative stress. Oxidative stress is the one which damages receptor. And when insulin receptor is damaged, glucose can't be transported. It accumulates, leads to diabetes type 2. And
Right.
another thing is sometimes diabetes type 2 become very resistant to insulin, can't do anything, can't drug, can't do then what you do.
Right.
And then it is very interesting that omega-3 has a specialized function, namely it directly activates this AKT molecule without going through the insulin receptor, directly does it. And when it does it, then of course it sends a message to glucose transporter protein, go to cell surface and let glucose come in. And then so this is very, from many point of view, is all the four components that I mentioned, you that take care of good micronutrient, take care of take probiotics with prebiotics, then collagen peptides and the omega-3.
Right. So that's sort of the whole cycle as well as the key ingredients which makes up for the.
That's right, exactly, exactly. And that it is not applicable to only Alzheimer. Same thing apply to Alzheimer disease. That's what I'm going to talk tomorrow.
Right. The sort of modalities, if that's
Yeah,
the word, it's
yeah,
similar
yeah,
across multiple conditions.
yeah.
Right.
And
Okay.
and so because there are certain things, for example, are common with aging. Certain things are specific to aging, and or specific to say, for example, diabetes. You know, people grow old without diabetes, but some people develop diabetes. Why? Because maybe he had increased oxidative stress, got damaged receptor, so can't yield the glucose.
Right.
So if you know all these four things in detail, you will have a good quality of life during aging, as well as reduce risk of all human diseases, including autoimmune disease. You name it, you will have
Right.
reduced. There is a lot of literature available, and I have written a review on every paper that every disease you can think of.
So that's fantastic. That's really good to know. And I mean, obviously, some of it is very scientifically minded responses. Some people will understand, but from layman
Sure,
perspective, we do understand that there are key ingredients which are addressable. We can
sure.
do something about it.
Yeah, yeah,
So, moving on to the mouth or oral care,
yeah.
as again, my interest to increase because of some literature I was reading, talking to people. So, what role does mouth play in the wider nutrition and metabolic problems in terms of discovering as well as addressing it?
The mouth depends upon if the mouth is damaged, either by disease, by accident, or whatever. And then in that scenario, number of harmful bacteria started increasing. Normally, if you have normal, healthy, well, it has good role because it has is not contributing any poor health. But if you have oral dysbiosis because you damage the, for whatever reason, either you have a soreness or disease or whatever, or you didn't take good care, didn't go to dentist for long regularly, and so that it happens, then it can contribute, just like a intestinal dysbiosis. Oral dysbiosis producing a lot of toxic chemicals, including pro-inflammatory cytokines, which is very, very damaging to all cells. And then gradually you get a disease. And
Right.
so if you block that right away, suppose if you have it, and then you put the probiotics with prebiotics powder in your mouth, then it will be it's tasteless, and
Right.
then it will take care of the bad bacteria. It does not kill. This is all good bacteria, probiotics. So it immediately resolve that issue within a week or two. And
Right.
so that's what I would suggest, that if you have that kind of situation oral, that you are suffering from some kind of oral problem, and then you know that the number of harmful bacteria will increase because there is a lot of scientific data on that. I
So,
was
so
amazed how much I was paying more attention to intestinal dysbiosis than oral dysbiosis. But when you brought up this issue, I went and looked at the literature. It's amazing how much data is available that how oral dysbiosis can contribute and what causes oral dysbiosis also.
right. And that's sort of interesting, again, coming from outside, the sort of unidirectional and bidirectional impacts. Again, that's something when we were talking about it, I even that enlightened me as well. I went and studied as well that part. So no, that's really good. And let's coming back to purely sort of nutritional side, right? In
Uh-huh.
terms of the effectiveness of nutrition for sort of reducing the chronic inflammations and disease risk, what sort of what role does it play, nutrition in that side, and what's the evidence?
Because macronutrient will reduce markedly the oxidative stress and inflammation. That is one of the central function of micronutrient. And if you say, people have been talking about, oh, you take a good diet, have a good lifestyle, you know, you will have it in good shape. Idea is extremely good, but there are two reasons. Human behavior as such, they don't follow the guideline of diet or lifestyle. You say do exercise every day, do. Maybe few people will do, but we always recommend it whether you follow it or not.
Yeah,
An excessive exposure to environmental agent. Many times we don't have a control over environmental agent. So how I'm going to do it? So what is the best thing? To reduce oxidative stress and inflammation. Because even though if you follow all these guidelines, they do not reduce oxidative stress and inflammation in sufficient amount to affect any disease process.
right. So,
And
so
so it is very important that you have a micronutrient which will reduce oxidative stress and inflammation. And if you are having a good lifestyle, good diet, reduce exposure to environmental toxins, that's further good.
So that's a combination of lifestyle in terms of
Right.
giving a good life, having a good diet,
Diet,
as well being able to supplements if required.
that's right. And reduce exposure to any place where there is a poor environment or, for longer time. Because poor environment also contributes to uh, poor quality of life. And because they increases also oxidative stress in your body, poor environment.
Right. So explain me a bit of when you say poor environment, what shall we
Poor
use to be?
environment like polluted air, polluted water, toxic. If you are a farmer, herbicide, you spray many things, they go all in atmosphere.
Right.
So there are many heavy metal. Many times certain water, certain areas heavily polluted with heavy metal like iron, not copper, but the aluminum and also metal like a heavy metal. But anyway, so those are the toxin. There are a lot of toxin in the environment,
Right.
more than you realize. Even in environment, people are smoke is coming out from the industry.
Yeah. And some of it is addressable, some of it is not.
Yeah,
So therefore,
especially in India. The air in India have a lot of particles. And that particles, you inhale it, that increases the risk of lung disease.
right.
So you can't control those things. This is not in individual control.
Yeah.
But what you can do it, you take micronutrient and you can't remove those particles from your lung, but that particle causes damage by producing free radicals. So if
Right.
you block the free radical, you can have some particles in your lung, but it will not cause any damage.
Right. I mean, what is one of the most interesting aspect when we were talking is how you look after yourself, Dr. Prasad, in terms of healthy aging. Give us some tips for the people who, in terms of their habits, what they can do to have a meaningful, healthy aging in terms of lifestyle as well as diet, if you can share.
Yeah, I mean, if you see, if you take a diet alone, good diet, good lifestyle, reduce exposure to you will have something good effect. But my problem is with that kind of, that we have been talking this for the last 50 years, but disease is increasing. Why? Because we have not affected the main causes that I mentioned, 4 different causes. We have not affected that, so you don't get any decrease in the incidence.
Right. Okay. So it's very rich, and I think to absorb all of it, viewers will need to have time think about every word you said. But if you have to give any closing remarks, what message do you want to give to our users all over the world who are watching
All over
this?
the world, only one sentence would be: take good diet, good lifestyle, do regular moderate exercise, and take a micronutrient, take a probiotic. If you are older, I'm talking about not for everybody, people who are say 18 years and older, and then take a probiotics with prebiotics, take collagen peptides and omega-3,
Right.
4.
Okay. That's very specific and useful. When I don't do all of it, I think I'll go back and start looking at my own habits as well. But Dr. Prasad, the privilege talking to you, and thanks a lot for your time. I look forward to talk to you again.
Sounds great. Thanks, Ravi.
Take care. Cheers. Bye.
Bye-bye.